May I take that question? Yes, the program is live. A couple different ways to enroll. You can enroll at any of our Apollo units, hospitals, clinics, spectra across the major cities in the country, as well as online on Apollo 247. You can choose TrueHealth. So it is available for anyone to book appointment at our unit.
Thank you, ma'am. The next question specifically is with respect to ProHealth again, but it's about PCOS in women, and that's considered to be one of the NCDs in the growing time. So how can ProHealth help here? This is a question mark.
So we've begun the ProHealth programs with diabetes, hypertension, liver disease and so forth, and we're expanding now to women's health, and it's our next focus. You did say POCS or did you say PKD?
No, PCOS.
PCOS, right?
Yes.
So we are expanding to women's health as well, and then over the next couple of months we will have a women-oriented ProHealth.
However, in the current, just adding to that, in the current dispensation, all ProHealth would then narrow down to a particular problem, and there will be a solution actually path to that. So a referral to a gynecologist and then the ability to treat that would solve the PCOS, and as we know, 1 in 3 women actually suffer, and most of them suffer in silence. So coming in for a generic health checkup and solving the underlying problems is really the crux of ProHealth.
Ma'am, thank you. The next question in line is about the question particularly from Sneha Shah. The question is about polycystic kidney, genetic disease. So why is there an issue and sector is not working on it? And what's the issue with the transplant in India?
Let me take that one. Polycystic kidney disease is an uncommon condition. We do see individuals who develop renal failure. Sometimes we have a combination of polycystic liver with polycystic kidney, which results in fibrosis and portal hypertension. So we need a liver transplant and a kidney transplant, and we have done combined liver and kidney transplants. Doing kidney transplants for polycystic kidney disease that has resulted in end-stage renal disease is not an issue, given the fact that we do close to 1,000 kidney transplants a year. But this is something that it is an uncommon condition, and perhaps we can chat offline on the specific case that you might have.
Thank you, Dr. The next question is again about personal consultation that someone requires in ProHealth. That's from Roma Gupta. Roma, if you could reach out to us, it's about endometriosis patient, stage 5, and wants some help from Apollo with respect to ProHealth. So I would request Roma to please write to us and we can connect you to the right person.
If I might just add.
We've made a note of your name, Roma. One of us will get back to you. You don't have to write.
Thank you. Thank you, ma'am.
If I might add, for endometriosis, now we've been really looking at robotics as a way forward in robotic gynae surgery. So, it's always a challenge in terms of invasive surgery, but with robotics, it kind of changes the equation. So just wanted to park that as well.
And we actually have the country's largest cities in this treatment modality.
Thank you. Thank you. Sneha has just a follow-up, that is the ProHealth program available for kidney disease?
Do you want to take that, Satya?
Satya, or should I?
So again, ProHealth is essentially, we look at your risk factors, right? And many of the NCDs tend to be asymptomatic, and it can be. But based on your family history, your medical history, environmental history, plus what we believe at your age you could be at risk for, it will diagnose, or at least through a set of investigations and consults that are required based on that risk. And so if kidney disease does throw up, then we do have, as part of that program, we will be able to at least address that issue comes up.
Thank you. Thank you, ma'am. I do not see any more questions related to NCDs or ProHealth or with respect to diseases. There is a question from Abhishek, and I would request Abhishek from Cogencies to write us to it separately. These are questions specifically on business front, and we'll be happy to answer that offline, Abhishek. So you could write to us. We'll reach out to you separately on that, Abhishek. Is there any approximate ranges of Pro Health packages that could be shared? The question from Ashwini Line.
Currently, it ranges from rupees 5,000 to about 13,000. So that's the current price.
Thank you, Dr. Satya. One of the questions is, how do you think this report can help influence the government policies containing NCD disease burden?
The government, the latest health minister, I remember, first even discussed on NCD, our health minister went to New York. They discussed saying that they will do follow a pattern how to diagnose disease early. I think there are so many other problems in healthcare. They are not able to deal that complete screening of the entire world population. I think if that happens, we can eliminate NCDs completely. So our idea is the individual must take, don't wait for the government to do it. I think the individual must say, my health is important. I posted you the price of your body. If that is true, you should take some interest and say, let me go for my health check and then find out how well I am. If you are completely well, you should very happy to maintain that wellness. If there are some problems, as I said, any one of these, we have now ways of detecting various diseases. And once that detected, the cure is not difficult. So I think we should not rest it completely on the government. They are doing several programs on welfare officers. I think individuals also must participate to have this personalized health care.
Thank you, Chairman sir. Is the Pro Health packages and Dr. Satya covered under insurance?
Insurance covers, I take that. Insurance covers their annual checkup for 1,000, 2,000, whatever that is. But way back when on the road, I got a thing, 5,000 rupees exempt from tax for your health check. But unfortunately, nobody is using it. In your checkup, you get tax reduction. But very few know about it, and even if they know, they are not using that. So there is a reduction, tax reduction on 5,000 rupees for a checkup, and for LIC it is different.
Thank you. This is about statistical reporting. I mean, the method of this survey done. I think Dr. Sujoy could answer that. How is this entire study being done? What is the statistical modeling for the study that was undertaken?
Am I audible?
Yes, sir. Yes, sir, you're audible. Go ahead.
Yeah, so the different statistical modeling that we used in this particular presentation or the kind of work that we've done. One, of course, is the visualization that we use through the typical Power BI or Tableau or other platforms. Our AI models are built on either R or Python, TensorFlow, PyTorch, and all of that. The kind of things that we normally do in statistical modeling is that, first of all, look at the very basic statistics, look at propensity matching when we are looking at different cohorts, And then, of course, we move on to building algorithms, which starts with very basic models at the time and then goes up to the extent of deep learning. That's the structure that we follow at the hospitals.
Thank you, Doctor. One of the questions that you see on chat, is this not comparable to global standards?
Can I take that?
Yes, Dr. Sudhir. Right.
Now, if you look at it, many of the studies that we have talked about are being published or are in the process of being published in the peer-reviewed journals. And, and these are very extensive, high-index peer-reviewed journals we are talking about. Dr. Sibal talked about the Energy and Catalyst. We are looking at the Nature Scientific Reports and others. And BMJ, where we are getting it published pretty regularly. So, these are definitely global standard reports.
If I can add, I want to add two things in this. One is that we need to keep in mind that what we have presented to all of you today is a series of different cohorts. One in analysis of preconditions and therefore the propensity to further illness. The other is a population study. And each one of these, so for example in total health, the WHO STEPS methodology of data capture was followed. As Sujoy spoke about, we've worked with Microsoft and the AICD. We've had our breast cancer algorithm validated and partnered with MIT. So in the summary, there's about 465 million lines of anonymized code extracted for relevance from summaries or data capture. And this is in an overall from about 21 million unique patient records and correlating to 600 different disease conditions. It is that extent of data which has then been culled into easily digestible, actionable insights for clinical care. But these are also being used in a series of other things. We're looking at it from Symptom Checker, which is on our health app. We're creating a back-end clinical intelligence engine. So I think the extent of knowledge, of anonymized data, of scientifically captured data being extracted to create clinical insights, and then presenting it today to you, one analysis or one view of this data is from the perspective of how it affects the health of the nation, how you can look at prevention through the health check, and how AI has been used. So a health check, and I want to reiterate this point so that for the benefit of the country, 5, 10, 15, 20 lab tests is not a health check. What you see in ProHealth, which is first a proactive, which test you need to do based on your patient history, which is AI enabled. Then you do the checkup, which is not only lab, but multiple others from stress to echo to ECG. Then you do the analysis of these reports with the doctor, and then you create the path to wellness plan. This is the proposition which can truly handle or control non-communicable disease to a significant level. Please, Dr. Ganguly.
So, actually, this is a unique effort. I don't see, normally these are government-aided or academic institute-aided efforts. This kind of effort where even a village as a unit data is not available in India. And secondly, the normative value, all these labs results, when I was at Promanchi, it was presented that create a normative value so that we could use it in the research. And it was so costly that we couldn't do. The Apollo published the first normative data of our country, and this was added on to that. And these normative data are helping us to really address it much more better than we were doing before.
Thank you very much, Professor Ganguly. Thank you, everyone. I don't see any more questions currently in chat, and so on behalf of everyone, I would like to thank the leadership team and all the doctors from the Apollo team. Thank you, friends from the media, for joining us on this important announcement. We'll be sharing the press release shortly. In case there are any more queries, you can get in touch with us and the Adfactors team, and we'll be happy to help. Thank you.
I'm sorry, there is one question seeking how you can get an online consultation. So ProHealth is a different program. Please just log on to 24/7 and you can get the online consult.
Thank you, ma'am. Thank you.
I see that in the chat box.
Thank you. Please be safe. Thank you very much.
Yeah, take care everyone. Happy World Health Day and stay safe. I think this is probably the only health conference in many months where we haven't really spoken about COVID, but COVID is still amongst us, so please take care and take care of yourselves. All the best.
Thank you. Thank you.
All the best.